Thank you, Chairperson and the communities. My name is Miss Love Mitrahim, and I appreciate the opportunity to speak with you today about a simple but a powerful idea. The earlier we identify children at risk for developmental delays, the better chance those children and the family have to thrive. So we need to ask this question: what's the importance and the benefits of early intervention for children? I'm here to ask you for your support for stronger early screening, family center early intervention, and accepting funding for service that reach children from birth through age 8. Based on the statistic, they say every year thousands of children started school already behind. Not because they can't learn, but it's because me and you, didn't act early enough. Let's take a moment. Let's imagine like a small child, 2 years old, struggling to use word, frustrated. And that child brain is that the architecture of learning and self-regulation is built right now. So that's why like they usually say that the smaller the kids are, the easier they will learn everything. Their brain is like a sponge. They learn everything. But the science is clear. The earlier we identify those issues and put evidence based support in place, the more we change developmental trajectories in way that last improving language, social skill, school readiness, and late academic life outcome. Early child intervention and high quality early education act as a protective factors, not only for short term, but it's really improving on long term health, educational, and economic outcome. Another question, like most of you might have, why do we need to collaborate with families? So collaboration with families is not optional, but it's essential. It's important. Parents know their children the best. They see the strength, they see the struggle, they see the potential every day. When professional and family work together, they can create individualized plans that fit the child routine, language, and culture. Research showed that families' professional partnership lead to a better developmental outcome than clinical only approach. I don't say it's not important. The clinical is important, but if we combine those together, it's way better than because those parents see their kids every day than those professional. Collaboration also builds trust. It ensures that intervention are meaningful and realistic for each unique families. It's reduces stigma. It reduces fear around special education. When family understand that early intervention is about growth, not label, they are more open to participate fully. Eggman stated that every dollars we invested in our children is returned into a return multiplied dollars to society. So basically, if we started being invested in our children, our society will be thriving. CDC stated that early service improve language, improve social emotional skills. We have Philip and Skonkoff. It said that early experience shape brains like a sponge. So those kids, like the early you act with them, the early like you will detect the issues. So what's the benefit? The benefits is improve school learning, social behavior, reduces need for costly special education later, build long lifelong independence. Where there's an obstacle, there's a solution. So despite of the clear benefits, several obstacles still stand in the way of effective early intervention. So the first obstacle we have is access to services is not equal. Can you believe that? Family in low income often face long wait lists or transportation challenges. So what's the solution? So the solution is use telehealth, mobile unit, and universal development screening. To address this, we need to change the conversation. But how can we change the conversation? Is by having a better training. Early intervention should be seen as early support, not a diagnosis. Also, public awareness campaign can help families see that seeking help early intervention seen as a strength. The system don't always communicate, especially among of the healthcare, among the early education and special education. So they often work separately. We should not have that if we're going to work for those kids. One of the reasons we might ask why they not work together, because it's a lack of coordination between those three. And how can we find solution? The solution is improve cross agency data sharing and communication. It's that simple. Obstacle four is women a challenge is funding, lack of money. We must advocate for better state funding to ensure that early intervention professionals are trained, have a proper training, support, and are available, and have it in every community. So what's the solution? So the solution is advocate for a sustainable family center funding model. The message is simple but it's powerful. Together, we can ensure that every child in our state starts school not behind, but ahead, ready to learn and go and succeed. So, one thing, acting early and early intervention, we give children the tools to reach their potential and empower families to become stronger partners in the children's life journey. We also save our community money by preventing more serious challenges later on. I urge this community to strengthen policy that support early developmental screening, family center practices, and accessible early intervention for all children. Thank you so much.